Hey guys, welcome back to Medical Coding with Blue. Alright, so I'm going to catch up everybody on what's been going on lately, and then we're going to talk about introducing clinical documentation improvement to your providers. Okay, so I stayed home today because I had a doctor's appointment that took a couple of hours to do because it's just the way that that's just the way the ball bounces sometimes, but good news is my blood pressure is really good. It's 114/79, so that's nice. I was always sort of wondering, oh, how is my blood pressure? My blood pressure is normally fine. It runs normal, 120/80. So whenever I see it lower than that, I always think that that's a really good thing anyway. Especially it's the holidays. It's that time of year when people start stressing, and I am not immune to that. Obviously, I'm like everybody else, but my body is handling it very well, so I'm like, oh, well, all right. So, but everything is good, everything is hunky-dory, so I am very glad. I always recommend your checkups, and that is what I did. My doctor that I had seen, I've been with her for 5 years, and my primary care doctor, I had been with her for 10 years. Both of them have left me, so my doctor that I saw today, this was my last appointment with her, so I'm very sad because, like I said, all those years we've been together, and it's like now I got to get used to somebody new. So what are you gonna do? And then I haven't talked about this much because I've been sort of scatterbrained with all these other things that are going on. The holiday times will do that to you, but I am going to be doing the catering part for my church's New Year's party. So I will be heading that up. And so in a couple of weeks, I will be doing the shopping, and then, of course, that day doing the cooking. I will have my phone with me, so I will be filming myself cooking. And so that way you guys can see what I have in store for the party. I love to cook. That is, aside from medical coding, it is partly cultural, because in my culture, this is what we do. I'm Hispanic. We love to cook. We love feeding people. That is what we do. We love good food, good times, good people. That is what I try to incorporate every day in my life. Whether it is, helping somebody out, as far as like my providers or another coder, that is what I like to do. So food is a huge part of that. So I will be pulling up some recipes and working on that stuff in the next couple of weeks. So let's go ahead and get into the meat and potatoes of today's episode. All right, so introducing clinical documentation improvement. Now, if you don't know what this is, all right, when you are looking at your provider's documentation, and if you are in a position where you don't have a clinical documentation improvement specialist in your facility, it does fall on the coder to do that function with the providers, most of the time. I know in my facility it does. Sometimes you'll have it in your facility where it is a designated coder that does it, or it is a supervisor that does it. I mean, it'll be like one person that will work with the physicians and the doctors and the surgeons to make sure that their documentation is in line with everything that they need, all the details that are on there, to make sure that they are getting credit for everything that they're doing. To have that good relationship and to be able to build that relationship is paramount. I mean, it is so important. There is, aside from being able to code very well, you have to have good documentation to work with, okay? Otherwise, you are having to scramble and pull out as much as you possibly can, There was an instance where I had a coder actually come to me, and she said, "Blue, this provider is not going to get any credit because I do not see a 6th bullet in his physical exam. Can you look at this? Because all I see is 5 points in his physical exam." And so for me, she knew that that I'm very strong in evaluation and management. So she's like, "Can you look at this and see if you can help?" She goes, "Because I can't see it. I can't find it." So I said, okay. So I look at his documentation, and his physical exam is so thin. I was like, oh, it makes me crazy when I see that. When I see a provider that has very thin documentation, and by thin, I mean like almost next to nothing. And to lose credit on account of missing one bullet, it is so hard. So I always try to make sure that everything is actually there or not there, before I zero out credit, because it is hard to think that a provider's going to lose credit for their time and everything else that they did. So I'm looking at this, and I found it. It was hidden, If you are not really strong with your body systems, as far as like knowing the language of each body system, it can hurt you. And in this case, it nearly hurt the provider. And I was able to find that sixth bullet. And do you know what the sixth bullet was? Can you guess? Probably not. The sixth bullet was capillary refill. Capillary refill has to do with the cardiovascular system, or the vascular system, not cardiovascular, but the vascular system, which is a system on evaluation and management in the physical exam. So this provider had noted psych, he had noted constitutional, he had noted neuro, he had noted, of course, the bones, the skin, and that was all she saw. But that capillary refill was the vascular point that she needed to hit 6, so that the provider could get the lowest level possible, because he had 6 points. And so I was just like, well, there it is. So she's like, oh my gosh, I almost gave him nothing. And I said, okay, that's where you really have to start looking at it. And I said, capillary refill, that's that vascular system right there. And so she's like, oh, okay. So she was able to give him credit and things like that. I did talk to him later, because I saw him in the hallway, and I said, sir, you have to be really careful. He's like, oh, well, I was just going really fast. And I said, well, I mean, fortunately, I had your back, because I was able to find that one more point. I said, but, that is something that you're going to have to start using your templates, or you're going to have to remember that you need a minimum of 6 points, or for like a detailed, because it was inpatient. So you need a minimum of 6 points. That is the lowest level possible. But if you are deciding to do surgery, or if you're deciding to do something major with this patient, you need to make it more comparable to where you are, and you need to hit those 8 points on your physical exam. And so he said, you got to try to remember that, Obviously, if you go in and you're looking at the patient as well, you're doing all of these body systems. You're making sure psych's okay, neuro's okay, they're all intact and everything. And constitutional, and their bones, and then the skin, you're still looking at them. What about the eyes? You still saw them breathing, right? That's respiratory. You're still having to see them, like breathe normally. I'm sure they use a little stethoscope and check out their lungs. Why aren't you noting that? And he's like, well, and I said, you got to try to remember that, because it's only to your benefit, because you are doing the work. We got to make sure that all those points are there. And so his argument too was, why do I have to have these points? That's when you have to sort of start explaining these things to them, because they don't understand. All doctors hear is either the medical coders nagging them that they missed something, or they have their clinic administrators telling them, you need to see more patients. We need you to be seeing 38 patients or 40 patients in an 8-hour day. Oh, less than that, 7.5 hours maybe. Maybe, if they even get that. That's all they're hearing. So that's why I say it's important to develop a good relationship with them, because they need to know that you're their partner, that you as their medical coder are going to stand with them, and you are going to fight for all the credit that they can possibly get, but you need their help. You need them to document everything that they're doing. This is why I always tell my providers all the time, guys, I am not in the room with you. I cannot see what you are doing with that patient. You got to tell me on paper, well, Bleu, it takes too much time. Okay, then we need to work on doing templates, or we need to work on having somebody like your nurses reminding you that you need to do this, or you need to make sure you're documenting that, or you need to put up signs in your office to remind yourself that if you're doing a laceration repair, you know, were you going through different layers? You know, did you, how big was the laceration? These are things that we need to know, because if a provider is not documenting, let's just say laceration repair, okay? If a provider is not documenting all of the measurements of the wound, like for like a laceration, they're not measuring that. They're not saying how many layers of skin they're going through, whether they're going through the subcutaneous or it's down to the muscle or whatever. If they're not documenting all that, you have to default to the lowest possible laceration repair code. And there's a huge difference between that and a complex repair code. And then when you're looking at total RVUs, and they have to generate so many RVUs because they all have their goals that they got to hit, right? And if they're not hitting those goals because they're not documenting, and then they don't have a coder that's telling them, hey, this is important, you know, and you will, you will encounter resistance. I'm not going to lie to you guys. It will happen. It will happen. You will encounter resistance, okay? So you just have to work with them, and you have to be patient with them, because they will come at you with, oh, I don't have time for this. I don't have time for your coding crap. I don't have time for this. True story, okay? Or they'll say, this is stupid. That's my favorite line. This is stupid. I don't have to do this. I never had to do this before. That's because you didn't have a good coder before who actually paid attention, or who's actually making sure that you know all of this stuff. Or maybe your coder just didn't tell you because they didn't want to get yelled at. There's always that. So this is why I say to be as engaged as you possibly can. And yes, they will fight you. Yes, they will say, I never had to do this, or that's primary care work. If you're working in a specialty clinic, that's primary care work. Okay, but if you have a diabetic patient, you're working in an orthopedic clinic, you got to make sure that that patient's diabetes is stable, right? Well, yeah. You ordered a blood sugar exam, right? Well, okay, were you able to do the shot today? Well, no, because their blood sugar's out of control. Okay, well, hello? Why didn't you document this stuff? I mean, you ordered the test. It's there. You know, you need to let me know what's going on. This affects your medical decision making. This is the whole argument. When you're looking at the evaluation and management tool, which I will try to find one. I was trying to find one online so that way you guys can look at it. Because I have mine, but it's unique to my facility. And but it's got all the different boxes on there, and it's all on one sheet, and it's front and back though, but it's really nice. And you know, this is going to tell you, like, you know, how to calculate the level. So when you're calculating it, then you can figure it out. But on there it says chronic conditions, stable, not stable, you know, additional workup being ordered, that kind of thing. Those are, you know, important to make sure that they're documenting. Things like if the patient has blood clots, okay, and they're on long-term use anticoagulants. There's also things that you can't do if the patient is on that. You can't just go and have surgery on this patient willy-nilly. That's an increased risk right there for them. If the patient has a blood clot or a pulmonary embolism and they're on long-term use anticoagulants, this automatically will up the risk if they are going to surgery. Okay, if they absolutely have to have the surgery, it's going to up their risk. If they have obstructive sleep apnea, again, it's going to up their risk, because they can't just be put to sleep. They have to be put to sleep in a certain way. If they are obese, again, that's going to up their risk, because they cannot be put to sleep in a certain position either. If they're going under anesthesia, they have to be put to sleep very carefully, because it can be detrimental to somebody that is obese. So these are all things that need to be documented, because these things impact the care of the patient. So talking with your doctor and being frank with them as far as like saying how important it is, because they're going to tell you, I don't have time for this. Okay, but if you're doing all of this work and you are getting a fraction of what you could be getting if you would just document better, there's a difference there. Okay, so you have to be patient with them, and you have to make it where they're not going to resist you. You want to foster that communication very well. You need to be able to say, hey, I'm here to help you. They need to know that you're there to help them. I had a provider who was new to me a few years ago. And he is a protege. Okay, and I say he's a protege because he worked very closely with Dr. X. Okay. And they had been in another facility together. And now when they were there together in this facility, when I first met him, I said, oh, okay, cool. You know, this is going to be good. You know, he's going to be just like you, and this is going to be perfect. And then I got to look at his documentation. What is this? What are we doing here? And so I said, he's like, Blue, I need you to get with him. And I said, okay. Well, I said, if he documents anything like you, he should be fine. He's like, no, you need to look at his stuff and make sure that he's doing okay. So I said, okay, sure. No big deal. So I started looking at his stuff and I'm like, I said, why? And I went back to him and I said, Dr. X, what? What is this? Who taught him? He goes, that's why I want you to work with him. And so I said, okay. Well, Dr. X and I already have this established relationship where we work together very well. And he understands my function as his coder. He understands that I am there to help him, okay? And while he may have some moments where he's resisting me, he actually does do what I tell him to do, which is beneficial to him because then it shows in his work. I'm just saying. In his documentation. Now, his protege, when I first told him, I said, sir, listen, let's sit down together. And I said, I know you're new to the facility. I said, let's sit down together and let's talk about your notes. And he's like, well, my notes are just fine. You know, what's wrong with my notes? And I'm like, well, there's some areas that could be improved. Okay. Well, what do you mean? And I was like, well, you know, you're missing your laterality, you're missing, you know, these other little details. You're not telling me this or that or whatever. Well, this is just stupid. I never had to do this before. I said, I understand. I get it. And he's like, well, you're just trying to make me work harder and this is ridiculous and I shouldn't have to do that. I said, okay. But if you don't do this, I can't give you credit. Well, how come the other coders that I had never told me anything? I said, well, maybe they never had a chance to work with you closely. I don't know. I can't vouch for them. Well, this is stupid. I'm not doing any of this. I said, okay. You hear me? And I said, yes. I'm not doing this. I said, I got you. I got you. And he storms off. So then later he comes back and he says, well, I have a question. And I say, sure, you know. And he's like, if I'm documenting all of this stuff, and he's giving me his example in his scenario. And of course, I'm trying to explain to him that he still has to meet the bullets if he's doing an evaluation and management. This is stupid. And I said, okay. And then I'm trying to break down the tool to him. Again, he's screaming and yelling. Well, now I said, okay. I've tried reasoning with him. I've tried to, you know, let's just try to relax here. And it's not working. What else can work? So I said, okay. So as he's yelling and screaming, and I said, sir, I said, look, I have a candy basket. I said, would you care for some chocolate? He goes, maybe. So I said, well, here, have some chocolate. And then he goes, I might. Thank you. So he takes it and he grabs his chocolate. He's like, I'll think about what you said. So I said, okay. So he opens the chocolate and he takes off. I'm not kidding. 10 minutes later, he comes back in. And he is... he went from being on 10 to being about a 2. Okay? And he said, I understand what you're saying now. I said, oh, you get it? He goes, I do. He goes, I'm sorry. It was never explained to me this way. And so I said, okay, well, I'm here to help you. And that's all I'm trying to do. I mean, I am on your side. I am here to support you. And I just want you to get into these good habits now, because you never know down the line if you're going to have an even more complex case. At least this way, you know that you're going to get full credit for everything. He goes, okay. So he took another piece of chocolate and he left. And now, I was talking to him the other day, yesterday, in fact, and I said, I got this note from him. I was going over his encounters, and I was knocking him out. I'm flying through his encounters. I'm flying, and I'm just like, wow. Because he's doing his own code selection perfectly. I'm rarely having to add anything to his diagnosis selections, right? Because like he's got all his diagnosis selected. And his levels, I'm having to either push them up. I don't have to push them down. I mean, they're either going up or they're maintaining because he's selecting the levels correctly. And I'm looking at this and I'm freaking out because I see this one note. And this one note, excuse me, was written so... It was when I see notes like this, I say these things are a thing of beauty. Because the way that he just wrote and he was giving his narrative about what was happening with this patient, and he was very, very detailed in it. And he put his time statement on there, you know, that he has spent time counseling and coordinating. He gave me his minutes and everything, just like I had taught him. And I'm looking at this note, and I'm freaking out. I'm like, oh my God, I said, this is so freaking beautiful. Well, if you've watched some of my earlier videos, like months ago, I talked about the Coder Awards, okay? Every year, I do the Coder Awards, and every year they love the Coder Awards, okay? Because they get all excited. They want to know who gets what award. And last year, the highest award was the MVP, okay? Because that was the first year that we had done it. And so that was the highest award, was MVP. And then there's best documentation, best use of injury codes, and that kind of thing. Each category for each provider is whatever their strong suit is, right? So this year, they're wanting it to be more funny. They want more funny awards. They want somebody to be the most improved. I don't know who I would give. I don't know who I would give that to. But seeing his documentation the way that it was, and knowing what we've been through all of these years together so far, and seeing him go from, you know, being okay documentation, maybe slightly, possibly mediocre documentation, to stellar documentation and correct code selections and detailed documentation and things like that. I was like, wow. So I saw him in the hallway and I said, you. And he's like, what did you know? And because he's coming out of surgery, right? And I said, don't worry. I said, it's good for you, but it's bad for me. And so he starts smiling. And he's like, what's up? And then I told him, I said, you had a note today that, I said, it was a thing of beauty. And he starts smiling. And I said, it was like reading poetry. And I said, so I want to thank you, because that was really freaking awesome to see. And he starts smiling. And I said, and I also want to tell you one other thing. He was like, yeah, what's that? And I said, you know, I'm still doing the Coder Awards. Uh-huh. You're in the running for MVP. He was like, what? And I said, yeah. You're in the running for MVP. I said, it's only you and one other provider that are in the running for MVP. And it's not Dr. X. And he's like, yes. So he's very excited about who will be getting MVP. He didn't even know he was in the running. I told him and the other provider that are in the running. I told him, you know, and I've already decided who won MVP. So tomorrow I'll be handing them out, and I will talk about that tomorrow on tomorrow's episode. But the moral of the story is stick with it with these providers, even when they resist you. stick with it. Because as long as you continue to have that energy of, I'm here to support you, we are a team, let's work together, it's going to be a lot easier for you. Because then, you know, had I just given up on him back when he was fighting me and not wanting to do what I asked him to do and saying it was stupid, if I had just given up on him, he'd still be with less than stellar documentation. He would be with very mediocre documentation. But because he finally understood what I was doing, and he finally said, okay, you know, you're just trying to help me, and I get it now. And the fact that I want them to develop these good habits. You know, I said, you never know who your coder is going to be. And there are coders that will dive deep and try to help. And then there are coders that will collect a check and go home because they don't quite have that same passion. And while there's nothing wrong with it, you know, I do think that if you are a coder, that you should shoot for helping your providers as much as you can. And when they resist you, it's part of it, okay? You just have to work with them and be patient with them through it. That's all, okay? There are different approaches, and I do recommend, like, reading leadership books. And even if you are not in a position of leadership, it's fine, because that will help you to be able to talk to another alpha personality. Because most providers are going to have that alpha personality. So you have to know how to communicate with them. And I've been telling you guys, I'm gonna post a picture of that book that I have about body language. That's another thing too. That's arming yourself with the ability to be able to read that provider, whether or not you are, what you're saying is sinking in and getting through. Because that is important as well. Because if you are talking to them and not really knowing if they're like absorbing it or not, then there's almost no point. You got to make sure that you are smart with your energy, okay? Be smart with your energy and start recognizing those signs of if they are accepting of you telling them this stuff or not, okay? Because you will encounter some that will not ever accept you telling them anything, because they are surgeons or they are doctors and they don't have to listen to you. And then there are those that will have that attitude at first, but then when they see the impact that you have on them, whether hopefully that is more positive than anything else, then they will see this person is trying to help me. And that will make all the difference in the world. Okay? Because these providers are always at risk for the pressure that they're under. I mean, burnout. And you never want to be part of that. You never want them to think, you know, this is one more person that is trying to stress me out. You want them to know that you're on their side, you're in their corner. And it just makes things better. It makes things better for you. It makes things better for them. And it makes for a more productive work environment. So, that is my thoughts today on implementing clinical documentation improvement. Okay, so I will go ahead and wrap this one up, but I will be back tomorrow for Quiz Friday. But if you have any questions, I am still stockpiling for Q&A Tuesday, so please let me know. And don't worry, I am going to be catching up throughout the weekend for Vlogmas as well, because Saturday I have a ball, union ball to go to, and I will be getting ready. So I will try to figure out a way that y'all can get ready with me. I go stag every year. Which is fine. I'm okay with that. But I do go with a couple. I was talking with my friend today, and she was like, I said it's our tradition of me being the third wheel, and then she goes, "You're not the third wheel." But anyway, I'm gonna go ahead and wrap this one up. So if you are a medical coder or a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see you on the next video. Bye.